in talking to Chris, the Purdue rep, who I guess he was watching something in one of the training videos or something, and they talked about, it was the testimony before Congress. And they kept talking about the appropriate patient. And he looks at Chris looks at the camera and goes, the appropriate patient is not the market.
Is not the market. Yeah, such a great line. I wrote it down too.
And I was like, that's a genius distinction.
We're the Good Doctors of Abbey Research. I'm Dr. Erin.
I'm Dr. Kristen.
And you are very welcome to our continuing coverage of the short docu-series on Netflix, The Pharmacist. We are up to episode 3, called Dope Dealers in White Lab Coats, which is, as we just discussed online, really what we were here for. The first 2 episodes were a bit too long and a bit too in-depth. This episode is where we really get our main protagonist, Dan Schneider, going for Dr. Cleggett, who is a proxy, really, for pill mills and doctors who are abusing the prescription of Oxycontin during the opioid epidemic. So we learn as we, he continues to not really get along with law enforcement or understand that they have, rules and laws and stuff. But we start to see the rippling effects of Oxy in the community, specifically in the community where he is a pharmacist. And I think that was an interesting, and I think we'll talk about this in this recap. It was valuable for me to have the perspective of a pharmacist and to see their approach to understanding the prescriptions that they're getting.
Yes. Agreed.
So we get a lot of background in this, a lot of it that we already knew from Dope Sick. But basically, we get introduced to a rep from Purdue Pharma who talks a lot about, again, the localized specific prescriptions and targeting within the Lower Ninth Ward and St. Bernard Parish area. And it was really all about this episode getting Dr. Cleggett proving that she is abusing the rights of a doctor to prescribe and over-prescribing Oxycontin. So there's a lot more yelling in my notes from me to Dan about his taping people, but eventually at the end we get to the workaround that the DEA has a hard time prosecuting doctors for legally prescribing legal medication, but the medical board is the workaround that Dan finds out through a 2020 expose of an Ohio doctor who was running a pill mill. God love 2020. And he takes his evidence to the medical board, who, then turns stuff over to the police and the DEA, and they bust Dr. Cleggett for real. And at the end of the episode, in one of the most, dramatic reveals I've seen on a TV show in a long time, we see Dr. Cleggett.
I was shocked.
She's alive. She doesn't look well, and I'm assuming we're going to hear from her in episode 4. So, Dr. Kristen, thoughts, feelings, discussion points from episode Trace.
I mean, just in giant, and I have a set of stickers that say this is fuckery, and this episode got one of the stickers.
Yeah.
Because there is no such thing as pseudo-addiction. There's no such thing as pseudo-addiction.
There's not.
That's a marketing tactic. What I loved about this episode in particular was the inclusion of so many other people who could give us unique perspectives on this drama, including Chris, the former Purdue rep.
Yeah. And
the way that he explains why they were doing what they were doing and what he could say and how he did it was, I think, really helpful to remember that the only truly evil people in this are the Sackler family and the heads of Purdue. Everybody else is messy at worst. And the kind of incentive program that he was told that he was busting his hump to make all of his incentives, and they said, oh, but the guy in New Orleans East is the best one in the company, and he's clearing $800,000 a year.
Yeah.
$800,000 a year, which means I cannot imagine what Cleggett was clearing. Like,
honest to God. Yeah, and we find out real early on as Dan starts collecting evidence. And it really goes back to like the number of prescriptions that they were getting at the pharmacy. And he, starts to basically creates a prescription monitoring program. Yeah. Which is eventually then something that is adopted by the DEA later into the epidemic. But he starts one at his pharmacy and finds that through 10 pharmacies, the DEA finds through 10 pharmacies in the area that Dr. Cleggett had prescribed 187,000 pills in 1 year.
In just 10 pharmacies.
In just 10 pharmacies. And, like, I actually had to pause the video at that point and just sit with the, like, we sort of got glimpses of pill mills, and we certainly got, anecdotes about them in Dope Sick. But, like, that was nuts. Like, spending this episode learning about what her operation was like and how many pills she was pumping out of her practice was staggering.
And that I love that it was pharmacists that called whistleblowers on this, because in high school I actually worked in a pharmacy, and I was just, I did some basic clerical stuff. I wasn't, formally trained really at anything, but I can't tell you the number of times that we called doctors and said, I'm looking at their medical history and this seems really high. Or I'm looking, and I was working in the pharmacy in the late 90s, early aughts. So like before this even took place, I quit the pharmacy in 2001 to go to college. And pharmacists know more than we give them credit for. And for for patients who see a lot of different doctors, pharmacists are often the ones in charge of making sure that your medicines don't counteract. And don't, because like you forget to tell your endocrinologist you're on this thing that your general practitioner put you on. And it's the pharmacist's job to keep you alive when those kind of things happen. So I was really glad to get this perspective that the pharmacist, evidently it wasn't just Dan raising the alarm. It was several pharmacists in the New Orleans area, and they all just kept getting told the doctors know best. And I don't remember this time. I mean, I was like far too young, and I think my own personal encounters with the medical profession have never led me to deify doctors. But I don't remember this time where it's like, well, we never question them. We never question them because they have the education. So it's fascinating to be reminded that was a predominant attitude, especially in the South, if not other places.
Yeah, and I mean, they don't get into this in the show, but we know there's a very racialized disparity in terms of treatment between black and white folks specifically, but basically white and non-white folks and the medical profession. And we've heard a lot in the last couple of years about a lot of people in black and brown communities who are hesitant to go to doctors and to get treatment because we know statistically there's this inbuilt bias within the profession. So it's like, it's a real tricky line to walk where we know that there are these biases, but we're also still like, well, they're the ones that went to medical school, so we shouldn't question what they do. And we're not really empowered as a society to question our doctors or to doctor shop or to, bring in other professionals like pharmacists. And it can lead to a lot of real harm for people. But certainly, I hadn't really thought about the role of the pharmacist in this context, and that they're trained to know, what levels you should be prescribed, what pills counteract each other, and they can look at your doctor's report and they can look at your prescription. And eventually, we get to a story in this episode where a woman comes in with her 16-year-old daughter with a prescription for, I think it was 80 milligrams of 80 milligrams of Oxycontin. And he looked at this little slip of a girl who was 16. He, like, looked at her weight and her body mass and all this and was like, 80 milligrams? That's ridiculous. And then he gets the report from the doctor at the emergency room that says he prescribed her with Tylenol.
Yeah, so that is really what we've been waiting for since we first heard of Dr. Cleggett, is that situation. So this mother comes in with a stack of prescriptions, Soma and Xanax and one other moderate painkiller I can't remember right now, and Oxy. Mm-hmm. And Dan's like, well, this is some bullshit. So he calls Cleggett to make sure that, I mean, we all know that Cleggett prescribed it, but he wanted to know if she really did. And he questions her dosage, and she dismisses him completely and says, you're not a doctor, which is also a lie because they have a doctorate of pharmacy degree, so she's a lovely person.
Yeah, I know. She's like, who the fuck made you a doctor? I'm like, his degree.
Accredited medical university, but thanks so much for playing. She seems like a gem. So then Dan takes those prescriptions to the medical board. And the medical board is who calls the ER where she was treated. And the ER is like, yeah, I discharged her with Tylenol. And she's 105 pounds. Yeah. And 80 milligrams is just a little much as a starter dose. So let's pump this on back. And that particular incident is what led to the downfall of Jacqueline Cleggett. And I also say one of the other, just to return really briefly to you brought up the race aspect of this, Jacqueline Cleggett's a black lady. Uh-huh. And I am sure that is one of the reasons that there was some hesitancy on some other people's part, because like there's not that many black physicians. Mm-hmm. And you don't want to take down this, what if she's really doing okay? What if she's doing great? And then the other DEA agent, whose name I did not write down, who's also a black lady, evidently goes to her house.
Yeah.
And is essentially like, okay, well, I can't go through this. I can't get the U.S. Attorney General to prosecute anything. They're dragging their feet. I'm going to go professional, woman to woman. And she doesn't say it, but you know she means it, like black lady professional to black lady professional.
Yeah. And
have a real heart-to-heart here. And she just about gets Jacqueline to turn in her license. And then we learn that Jackie's got 3 kids to put through college. Mm-hmm. This is also when we begin to get the insinuation that Jacqueline is using while she is prescribing in the same as our good old Dr. Phoenix. And that the DEA is aware of this and is collecting data on it and information on it. Eventually, that's what the medical board uses. Evidence that she was using while prescribing is what the medical board uses to eventually kind of really go after her. But it's unbelievable to me that in a slight way, in all of the mess of this and how long Cleggett had been, that no one else thought to go to the medical board. Like, it's mind-boggling to me. Like, why didn't... My first thought with any professional when they screw up is not to go to law enforcement. It's to go to their licensing board.
Yeah. Yeah, because effectively, like, the argument that they were making was that she was abusing her physician's license.
Her physician's license. So why don't we go after the license? Why... I don't understand why that took so long.
Yeah, if we can't prove, like, that she is intentionally breaking the law because she is a licensed doctor, they are legal prescriptions for legal medications, etc. Like, they still have, like, you know, an oath to first do no harm. Like, if you can prove that she's harming folks, whether it's legal or not. And I thought, I mean, thanks to the guy, like, the way we find out about the medical board is through that 2020 episode that Dan Schneider watches, and he calls the prosecutor who was in... Like,
the state attorneys general in Ohio.
The state attorney general in Ohio, or, like, whoever, the U.S. attorney in Ohio who was prosecuting the case, and calls him and was like, dude, how did you do this? We've got a lady running a pill mill here. Like, I need to take her down. He was like, oh, medical board, man. And he was like, wow, yes. Because the medical board the DEA has, like, a much higher burden of proof. which is something that I hadn't necessarily, like, thought of in this context. And, like, we get that, hints of that in Dope Sick.
No, but it's great. I mean, they are a federal enforcement agency versus a licensure board. Like, it makes sense, but none of us thought of it. Yeah.
None of us thought of it, yeah. And the point they make in this episode is that the medical board can come at it from an administrative angle, not necessarily a legal, illegal angle. And eventually, they strip her of her license, and then they have gathered enough evidence to turn the case over to the police and the DEA. And I think we'll hear more about that in episode 4. But yeah, this is a crazy story, y'all. Like, I think the whole time I sat through the first 3 episodes, I was like, this is nuts.
Yeah.
This is some crazy human behavior.
Crazy human behavior. I remember when we started getting news clips of people getting arrested for pill mills and being constantly shocked at how old and well off they seemed. Like,
why are you doing this?
Like, you're wearing a Chanel jacket. Like, what are we doing here? And it just everything keeps coming down to greed. They could just make more money. And that's what it all comes down to. And people are willing to sacrifice a lot for the prospect of quick money.
Yeah, and I mean, we got that perspective from Dope Sick and the exposition on the Sackler family and their role in this. And, I think we're getting it from the kind of perspective of the doctors that abuse that system. And I'm sure there were pharmacists that abuse that system and drug reps. I wonder how much the drug rep that we get in Dope Sick was like whether they were filming and they knew about this guy that had come forward that we get to meet in this episode, Chris, because there's very similar arc to the character of the rep manager in Dope Sick that we get a lot of similarities. But yeah, like, you either took advantage of the system or the system took advantage of you,
and most likely a combination of both.
Yeah. And this, I appreciated his honesty in explaining what he knew and what he didn't and what he chose to ignore for a while he was making money, which is a big part of the human condition. But yeah, I was happy we got this episode, because after the first 2 episodes, I was like, this is about the why are we watching this? And then I was like, oh, cool. Well, this is why we're watching this.
Yeah. The only other thing that we haven't talked about that I'd love to bring up is the incredible importance of questions. That's really what Dan Schneider does.
Yeah.
He just asks questions. Now, I do not approve of his methods, as we've talked about at length on this channel, both on and offline. But it's really what he does. Is he just goes, this doesn't seem right. Who do I bug about it?
Yeah.
And that's what whistleblowers do. That's why we have Elizabeth Holmes on trial, because somebody at Theranos went, this isn't working. Who do I talk to about this? The history is changed by the inquisitive. Mm-hmm. And we need to be asking questions. Yeah. And if something doesn't feel right, ask why.
Yeah, that's a really important point. And, his insatiable, curiosity is only matched by his insatiable need for justice and accountability that leads him to make some questionable choices in terms of the methods of which he asked questions.
Yeah.
And there was more, I just found this giant note in here, y'all, while I was just yelling for 5 lines in all caps about recording people without their consent and illegally obtained information from a person who is not a law enforcement officer. And then the end of my thing is, why is no one telling him this? Why is the DEA not you can't do this? So maybe,
they probably did, and he just knew better.
And he was just like, I'm going to do it anyway. God love.
Oh, the only other line I wrote down is in talking to Chris, the Purdue rep, who I guess he was watching something in one of the training videos or something, and they talked about, it was the testimony before Congress. And they kept talking about the appropriate patient. And he looks at Chris looks at the camera and goes, the appropriate patient is not the market.
is not the market. Yeah, such a great line. I wrote it down too.
And I was like,
I wrote
that's
it down too.
a genius distinction. Of course, the appropriate patient is not the market. So why would they ever want to help shut down pill mills? Pill mills are what's buying them 17 wings of the Metropolitan Museum of Art. Like,
yeah, all the profit came from diversion and from physicians that were abusing the market. All of it. Because otherwise it just would have been, prescribed like other pain medication. Yeah.
I mean, probably not all of it. Like, it's still, like, they charged because the other piece of this, and no one talks about this in Dope Sick really either, Patrick Raddenkeefe gets into this in Empire of Pain. The reason they even created OxyContin is because their patent was about to run out on Contin. Mm-hmm. And so they had to get it to where it couldn't be made generic and you can charge whatever you want for it.
Right.
So that's one of the reasons that they keep making money, even outside of diversion. You are totally right. But I want to bring up that they are still gross outside of how much money was made on diversion, because the appropriate person is not because they control their money so tightly and don't allow anything to be genericized. Everything stays name brand.
Right. And what we saw too that they did from the Purdue angle in Dope Sick was they continued to create higher doses.
Yep.
Which you can then charge more money for.
Correct.
So they were like, oh, well, now we need 40 milligrams. How about 80 milligrams? How about 120 milligrams? So I think in order to like explode the market as well, saturate it.
So they could have still made billions with and cracked down on pill mills.
Yeah.
Is part of my point, I think. Like, it is just unchecked, voracious greed.
Greed and power. Yeah. In a way that is like 10 pharmacies. In the New Orleans area, this woman prescribed over 187,000 pills of OxyContin.
In 1 year.
Like, in 1 year.
Fathom that.
It's just actually mind-blowing.
I've taken a lot of pills in my lifetime, and I don't think I've cracked 100,000, like, over 38 years. Like, I also had to pause and I just sat back in my chair and went, holy hell, she's a lovely person.
Yeah, she's the nicest. Yeah. And, we do get, I was glad that we got this. I'm glad that I watched Dope Sick before this.
Yeah, it fills in a lot of blanks.
Yes, this fills in some blanks, but Dope Sick certainly has given me the whole context for it. So when they got to the part about Purdue specifically in this episode, I was like, yeah, I know all this. They're liars. They're liars. They're liars, and they lie some more. But at first in the first couple episodes, I'm like, why do we need this and Dope Sick? But this was one of the episodes where I'm like, no, this is a good companion piece because it gives you some of those perspectives and broadens our discussion and understanding, not necessarily from the rep side of things or from the Purdue side of things, like the pharmaceutical side of things, but from the medical side of things.
Yeah. It's an entire system. Mm-hmm. It's an entire system. At some point, somebody is going to talk to us about why insurance companies kept paying for this drug. At some point, we need that. I know Beth Macy, Benjamin Rubin let us know that Beth Macy is working on a second book right now. And so, and he's read maybe even all of it. So it might be imminent. It might be this year. And maybe she covers insurance in that, because you can't really have a medical conversation in the United States without talking about our privatized insurance. So it would be nice to get that final piece of this, and why they'll pay for Oxy and not rehab, and kind of what that all looks like, and everything else. So, but I'll say I dropped my pen when Cleggett showed up on screen. That was absolutely the craziest reveal at the end of this episode. I thought for sure the reason we kept seeing just footage of her was she was dead from an overdose, to be honest.
I know.
Or she had been murdered by a patient.
Yeah.
I was not anticipating living, breathing Jacqueline Cleggett.
While you were talking about that, I looked up Beth Macy and apparently found a link on French or maybe Brazilian Amazon. Hilarious.
Cool.
It's called, it comes out this year, her new book, Raising Lazarus, The Search for Hope and Justice and the Future of America's Overdose Crisis.
Oh.
Pulls the massive national health crisis that is opioid addiction down to its compelling, character-driven, blah, blah, blah. This is the necessary follow-up to Dope Sick, deeply reporting and full of breaking news that makes clear the entire swaths of America, especially rural America, have been left to fend for themselves.
Mm-hmm.
Macy examines what happens when political forces beyond the control of individuals come to define generations of Americans. This complex story of public health, big pharma, dark money, politics, race, and class will take the story of Dope Sick into the present day, showing that the increase in the number of overdose deaths during the COVID pandemic illustrates the tremendous need across America to change the conditions that make addiction so prevalent and which prevent those seeking treatment to begin new lives. Whew! We will be talking about that book when it comes out.
I'll be pre-ordering that as soon as we get off this call for sure.
Pre-order.
Even if I have to pre-order it from Brazil.
I don't know why that. I was like, I would just like a description of the book, please. Okay, Brazilian Amazon. Not the Amazon in Brazil, but Amazon.com. Hey. Yeah, so it doesn't sound like she'll explicitly get into insurance companies. If anybody watching this knows about a book or documentary or that talks about the role of insurance companies in the opioid epidemic, please let us know. We are always looking for recommendations and help in our continuing learning about this. So that is definitely a piece that we're missing. We did not get that in Dope Sick. We did not get that in The Pharmacist. So now I'm intrigued. Yet another rabbit hole.
We do love a rabbit hole. I think that's all I got for this episode because everything else... that's kind of would just be I'm just repeating myself of how much I hate Purdue and how much I would like to breathe fire onto Jacqueline Cleggett. So we can hit pause here and head on into episode 4. Friends, if you liked this coverage, we would really appreciate a thumbs up on the video. The algorithm likes it, and so do we. If you like our coverage entirely, we would appreciate a subscription. We have conversations about popular culture and the opioid epidemic, but also a lot of other things. And we would love to have you join them for us and join the conversation. Never hesitate to comment below a video. We would love to know your thoughts on what's going on, either with your own personal story or resources you have. And as always, with topics like this, we put out the call that if you would like to come on the channel and tell your story about your intersection with this epidemic, we are happy to offer up our YouTube real estate. In order for you to do that, just comment below and we'll get in touch. In the meantime, wherever this video finds you, we hope it finds you safe and healthy and in a manageable amount of pain.
Thanks for watching. Take care, everybody.